Choose your character.
Hi and Assalamualaikum. Suicide is the act of intentionally causing one's own death. Mental disorder, physical disorder and substance abuse are risk factors. Some suicide are impulsive acts due to stress, relationship problems or harassment and bullying. Suicide is a global public health concern with millions of lives lost each year. Statistical analysis play a crucial role in understanding the prevalence, risk factor and pattern of suicide. The study of suicide through statistical analysis is a complex and sensitive field that requires a nuanced approach. This video, we will examine statistical technique used in analysis of suicide data in population people around the world in 1985 until 2020 and the sample which is country that had letter A in their country name. Through statistical method, we will describe the number of suicide cases in country that have the letter A, and then detect the gender of the victim, and the last one, determine age that have the most victims.
Assalamualaikum. Next, I will continue why men tend to suicide more than women. The first one is gender roles. Men are often socialized to suppress their emotion and not seek help, while women are encouraged to express their feelings and seek support. This may make it harder for men to cope with stress or mental health issue, leading to a higher risk of suicide. The next one is mental health stigma. Men may feel more stigmatized or ashamed about seeking help for mental health issue, leading them to avoid treatment and potentially increase their risk of suicide. The last one is substance abuse, because men are more likely than women to abuse drug and alcohol, which can increase the risk of suicide. So overall, the analysis shows that the statistic of men is 76% more higher than women. So yeah, thank you very much.
Hi and Assalamualaikum. So today I will talk about the suicide case according to group of age. So there's a lot of factors that lead to this suicide case happen. So first factor is relationship problem. Relationship problems including marital or family conflict can increase the risk of the suicide, particularly when they lead to the feelings of social isolation of despair. Second, financial stress. Financial stress including the job loss, bankruptcy, financial insecurity and increase the risk of suicide. Thirdly, social isolation and lack of social support can increase the risk of suicide, particularly among other adults. And next, I will talk about the suicide case among the country that have many suicide cases rather than other country. So we figured out that South Korea have the highest suicide rates among the other country. So South Korea has a complex relationship with suicide, and suicide culture is a topic of ongoing concern and discussion in the country. While suicide is not unique to the South Korea, the country has one of the highest suicide rates in the world, and suicide has been identified as a significant public health issue. One of the key factors that has been identified as contributing to the suicide culture in South Korea is the strong emphasis on academic and professional success. There may be a pressure to excel the education and career, which can lead to the high level of stress and anxiety. Additionally, failure of perceived failure may be viewed as a beginning shame and dishonor to oneself and one's family, which can make a suicide seems like a way to escape from that shame. There is also a culture taboo around the mental health issue in South Korea, and seeking help for mental health concerns may be stigmatized. This can prevent individuals from getting the support they need to manage their mental health and may contribute to the feeling of hopelessness and despair. Efforts have been made in recent years to address the suicide culture in South Korea, including increase the funding of mental health services, suicide prevention programs, and effort to reduce stigma surrounding mental health issues. However, more work needs to be done to address the underlying cultural and societal factors that contribute to the suicide in the country. Thank you.
Hello and Assalamualaikum. Today, I will be discussing about suicide and as a complex and multifaceted issue that can have devastating consequences for individuals, families, and communities. According to statistics, since 1985, males have been committing suicide more than females. This is concerning that deserve attention and further investigation. Additionally, it is shocking to learn that the lowest age range for suicide cases is between 5 to 14 years old. This is a saddening reality that requires immediate action to prevent such tragedies from happening. Lastly, it is important to note that the Republic of Korea has the highest suicide cases per 100k population. This is a serious concern that needs to be addressed through effective policies and intervention to prevent further loss of life. In summary, suicide is a serious and complex issue that requires a multifaceted approach to tackle. It's important to raise awareness, educate communities, and provide access to mental health resources to prevent and address the underlying factors that contribute to suicide. Thank you.